There's this misconception, I think, that people just assume that cosmetic surgery is easy. You know, a lot of people go get their hair done, they get their nails done, and they think, well, it's time for me to get a little bit of lipo or a little nip and a little tuck, and they think it's that easy. And because of that, they make the mistake and they go to the cheapest place. A lot of them go to Mexico. And unfortunately, cosmetic surgery is real surgery.
The biggest thing that I see when a patient comes in from like a botched job or unrealistic goals or unsatisfactory results from someplace else is usually miseducated. People don't take the time to sit and get to know that person and be realistic about what their expectations should be.
So I think there's an important thing. People always say, oh, they're so expensive. Not really. It's just that we have anesthesia. So anesthesia is important. We have a real OR with hospital staff personnel taking care of you and nurses. That is an important component. People don't want to do awake cardiac surgery. They would never do that, or an awake gallbladder surgery. They know they're going to go to the hospital and have it done under anesthesia. Well, it's the same if you're getting a big tummy tuck with breast augmentation, breast lift, liposuction, fat transfer. These are big surgeries. People don't take that into consideration, and there's a big push by some of these less trained, less qualified people to say, oh, it's no big deal, I'll give you some IV sedation, you'll be fine. And then the patients realize, no, I'm not fine. This is very painful. I don't like what you're doing to me. And that's something that people need to take into consideration is, am I gonna get really a holistic team taking care of me? Or am I just gonna be stuck in a little room with some surgeon by himself with a little IV sedation and maybe one of his secretaries assisting in the OR? That's not the situation you wanna find yourself in. And a lot of people, they find themselves in those situations and then they feel like it's too late for them to back out. No, you can say, stop, I'm not comfortable with this. I need to go somewhere where it's done right. I invite anyone who's interested to come see us. There's a lot that we offer here in the clinic, all under one roof.